All right, my friends, had a lady on the comment section of my video I did Social Security taxation ask if I could do one on Medicare. And actually, I'm happy to do that because Medicare is, I mean, I tell you, if you think Social Security is a nightmare, you haven't seen nothing. Look at Medicare. It's freaking nuts, man. So let's do this. I think it'd be a good video. I've done other videos on Medicare. I interviewed my man J.O. About state-by-state Medicare planning. Jay's just so busy. I'm so busy. We just kind of put that on the hiatus for the time being. But J.O. is a guy that I definitely refer people to that you should talk to about your own planning. He's licensed in all states. He's a certified financial planner. The whole thing. That's Jaeoh. J.O. Jaeoh. I think he's Korean. He's American, but I think his dad was from Korea or something like that. But he's a good guy. His dad's a medical doctor as well. So they know, or Jay does, how this works from watching his own dad's practice and then becoming a financial planner on his own. The interesting thing about Jay is he was a derivatives trader actually for a long, well, I don't say a long time, for a while. And then he recognized, well, I'm speaking out of, I don't know this to be fact, but I think he probably recognized options trading isn't really helping anybody, and he wanted to help people with their financial planning, and the Medicare was a deficiency big time among financial planners. I'm telling you it is. And he said, look, I want to go and help people. I want to use my knowledge, my skill set as well. And so he wrote the book, Maximize Your Medicare. Maximize Your Medicare. So you should get the book, and I'll put a link in the show notes. I mean, my goodness, if Medicare is on your mind, and frankly, it should be for everybody, you need to get that book, Maximize Your Medicare. And then, sign up for Jay's podcast, whatnot. It's interesting, though, he did say about being a derivative trader that there's a lot of similarities between how Medicare is priced in derivatives trading. And I just, it's a hedge. It's a hedge. And I got a kind of chuckle out of that. Who'd have thought Medicare and derivatives trading could be co-joined, but apparently they are. And I'll leave that for Jay to talk about that. But all right, so let's go over Medicare. All right, so first and foremost, and for the record, I learned a lot from Jay. All right, I mean that's just I'm telling you, a year ago, if you would have asked me these questions, I would have no idea, none whatsoever. So two things: A, open up your mind to learning for sure, and B, don't be so overwhelmed that you think you can't learn and they're just going to rely on insurance companies to tell you. You can't. It's not. Once you take a few moments to just focus in on this, you can learn this stuff for sure. Will you ever be an expert? No. Do you want to be an expert? No, absolutely. But just give yourself some time, give yourself a month, and I'm telling you right now, if you give a month of reading, you'll know more about Medicare planning than I can almost guarantee you the vast majority of financial advisors out there, CFP or otherwise, because this is not taught. It's not. It's just, it's nuts. And so Medicare is one of the biggest expenses you're going to have, in terms of Medicare. We'll get into the numbers here. And yet no one knows how it works because they don't train this in financial planning. Why? Because financial planners are trained to raise fees by getting assets. So we do whatever we can to get assets, which notice Medicare is not a fee thing for us, so we don't pay any attention to it, which is nuts. All right, so let's go to Medicare. So Medicare, oops, that's not the, let's use this guy instead. Medicare, oh yeah. All right, so first thing we got to understand when it comes to Medicare is how is it financed? And here is financed with FICA, all right? Now FICA is FICA is broken down to OASDI, which is your old age disability insurance. So old age survivor disability insurance. So you have, that's your retirement benefit, that's your survivor benefit, and that's your disability benefit. It's also broken down to HI. And HI is part of Medicare, which is called your Part A. HI stands for hospitalization insurance. All right, so once you hit 65, because 65 is when you get on Medicare, you automatically have hospitalization for insurance for free. And that's your Part A, is hospitalization insurance. All right, now trust me, my friends. I think it's 2.4, whatever the 2% amount is, that's not nearly enough to cover the cost for hospitalization insurance. It's not, which is why Medicare is in a world of hurt for sure, because they're not charging. That's all there is to it. All right, so that's Part A, is hospitalization insurance. But that's just go to the hospital. That's that's not, I mean, that's great. You're going to the hospital, but you still got to get a physician to see you, no? Or somebody up there in the hospital's got to take care of you. So hospitalization insurance just covers the building. It doesn't cover the human being, or maybe one day robots that are going to take care of you. So now we got, so Part A. Now we got Part B. And that's your physician's service. All right, so Part A is the hospital, or some guys will say the building, and I actually like that, the building. And here's your physician services, Part B. All right, now Part B, you haven't paid anything for it. That's not, part of the FICA doesn't cover Part B. It only covers Part A. So as 65 years old, this is free. But this is not free. This costs basically $135 a month. Now, it depends on your income, your modified adjusted gross income. It could cost more. In fact, significantly more if your modified adjusted gross income is above a certain threshold. Roughly, I think it's $87,000. If you're single, $170,000. If you're married and whatnot. And I'm not going to get to that right now. We're just going to say it's $135 a month. Now, some people say, oh, it could be free if you're on Medicaid. I don't like that. I'm telling you right now. If you have assets and you're trying to hide them so you can go on Medicaid, I'm not a fan. I don't think you should do that. Actually, I think it's a moral judgment. But there are people who actually need Medicaid who don't have assets to hide. And so if you have assets and you're trying to hide them to get on Medicaid, you are inherently taken away from people who don't have assets to hide, who cannot now get on Medicaid. Medicaid is for indigent people. If you're hiding assets to qualify as indigent, I just think that's wrong. I don't think you should do that, and I'm not going to be party to that, any of that kind of talk, because it's wrong. You're blessed with a certain level of affluence here in the United States. There are people who don't have that same blessing, rightly or wrongly, however they got there. So for you to kind of shelter those assets in order to make yourself seem like you're one of these people who don't have the assets, I morally object, without question. Without question, you shouldn't do that. Never mind. And on top of that, you really want to go to Medicaid facility? My God, this whole idea of Medicaid planning, I can't stand it. All right, so that's Part B. So Part B covers your physician services. Now, these two things combined are original Medicare. All right, and that's from the 1965, I think. Yeah, 65 law that LBJ signed. All right, so that's original Medicare. But notice a couple things. What we know is original Medicare covers 80%. That's it. Only covers 80%. So that means, and look, this is somewhat basic stuff here, so don't get, it covers 81.8%. Look, 80-20 roughly is what you need to look at, 80-20. So if you have a bill $100,000 for a hospital and physician services, you're going to pay $20,000 because Medicare, the Center for Medicare and Medicaid Services, will pay $80,000. So you're on the hook for $20,000 under original Medicare. So Medicare pays $80, you pay $20. All right, with me so far? All right, so that's where something else kicks in underneath the Part A and Part B. All right, because that's original Medicare. And we're going to get back to pricing and all this. Don't worry. All right, so that's where we're going to go to. Let's see if this black one works. No, that's not one. This guy here. All right, so that's where we're going to go to Medigap. You got to dry this. So hold on just a second, my friends. Got to dry this off a little bit better. There we go. Medigap. Because Part A and Part B only covers 80%. So we have Medigap. All right, so Medigap or Medicare supplements. Am I spelling it right? Supplemental, something like that. Medicare supplemental policies. All right, so that is we have the 80-20. Where you're on the hook for a 20%, but now you got a Medicare supplemental or Medigap's the same thing, and that picks up that 20%. All right, so that's what happens now. We got original Medicare, these guys, Part A, Part B, but it only covers 80%. Now we have Medicare supplement or Medigap policies that will pick up the rest. Now these aren't free. All right, these are not free. These are, I say, between $100 and $200 a month, depending what state you live in. Some states are more expensive, some states are less expensive, but either way, I use on average $150 a month. All right, so that's what I'm saying. So now the benefit of Medigap, we're just gonna call it Medigap. Medigap and Medicare Supplement, same thing. The reason I recommend going this route is because it's the biggest network there is. You're always in network. Any doc who accepts Part A or Part B, any doc you have access to. Now, that doesn't mean you have access to him tomorrow. It just means you have access to him or her. If he accepts Medicare, he will accept Medigap. That means if you're living in Boston and you go and see your grandson in Topeka, Kansas because he just graduated high school, you will have access to a healthcare provider so long as any healthcare provider in that city accepts Medicare. Does that make sense? That's a big deal. I think that's a huge deal, and I think it gets overlooked quite a bit because, I mean, there's so many providers out there that you want to make sure you have access to them. No other way around that. And if you're going to Anchorage, Alaska, you want to make sure that if you get sick or something like that and you need a doc, that there's someone there who accepts it. And I think that's $150, a small price to pay for that coverage, the in-network coverage. You are in the largest network there is, which is Original Medicare. So I'm a big fan of that. Now, there are alternatives to Medigap because Medigap, like I said, isn't cheap. I mean, it's $150. And the alternatives are going to be Medicare Advantage policies. Medicare Advantage policies. All right, so let's talk about these because this is a big deal. And this has become more and more prevalent among retirees. All right, so these are going to be called Part C. Open. Part C is Medicare Advantage. Oh my man, that's not. Let's get rid of this black one. Let's go back to blue then. Yeah. Horrible. Part. There we go. C. Medicare Advantage. Now, what happens with Medicare Advantage is it's basically this right here. Part A, Part B is in Part C. Medicare Advantage. All right, so Medicare Advantage, now the difference between Medicare Advantage and Medigap is that Medicare Advantage does they'll also pay that 20% we talked about, all right? So Medicare Advantage, you know for a fact what your out-of-cost maximum will be. That's part of the deal with Medicare Advantage. Now, the drawback about Medicare Advantage is that it is run by the insurance companies. They get a price per head, per beneficiary essentially, from the CMS, the Centers for Medicare and Medicaid Services. So they get, I think it's like $1,500 per insured. So if they can literally do economies of scale, they can price it accordingly. So the insurance companies, Aetna, United Health, I think is through AARP. Anyway, so they'll say, okay, we know for a fact we're going to get $1,500 per beneficiary. Our actuaries say it's going to cost us $1,100 per beneficiary, so we're making $400 per person. And what they have to do then is they got to make sure they're covering here, Part A and Part B. They got to make sure, guarantee that there's a limit to your out-of-pocket expense. And then they're going to throw other bells and whistles in there too, as an incentive to get you to buy their policy. I mean, it's actually a pretty competitive market, fiercely competitive. In fact, we're talking, I mean, these guys they're competing big time. So Aetna, United Health, whatever the other ones are, Kaiser Permanente, I guess, Blue Cross, they're all competing heavily for your dollars. The drawback, though, is that every single insurance company is going to put you in their network, and their network is going to be limited depending on where you are. If you find yourself in, Jay and I were talking about, there is no Medicare Advantage offering in Alaska. At least that was last year because there was not enough of a network that insurance companies could give to you. So the network was limited, and it was so limited that it wasn't worth it for the cost benefit for them in order for the profitability to provide a network for residents of Alaska. So there was no Medicare Advantages offered to you in Alaska. So you're going to Medigap or you're going to Original Medicare, which is going to put you some serious risk for sure. So we know with Medicare Advantage, it's going to be cheaper than Medicare Supplement because it's going to be in network. They're going to limit your ability to see a doc within their network. Now, if you live in Miami or Phoenix or a big Boston or something like that with a big, a huge amount of retirees with lots of doctors and hospitals, probably no big deal. In fact, Medicare Advantage might be beneficial to you because it is cheaper, significantly cheaper. Some Medicare Advantage policies don't cost you anything. That's how much the insurance company wants to get you on their thing. They say, we're not going to charge a premium. Why? Because they know under the actuarial tables that you will cost them at the end of the day $1,100, but they know they're getting $1,500 from CMS. They're like, we're not going to charge anything. Now, there's more to this story than that, and we'll talk about that just a second. But I mean, my goodness, if you're strapped for money and you're eating cat food, Medicare Advantage policies are probably better than Medigap, because we don't want you to have the greatest insurance, but you're eating cat food. That doesn't make any sense. So Medicare Advantage can be very beneficial depending on where you live. The drawback here is two things. If you're living in Boston with Medicare Advantage and then you go to Topeka, what's the likelihood that a doc is going to be in network at Topeka for your visit when you live in Boston? And frankly, I just don't know. I mean, it might be high. I don't know. I mean, insurance companies aren't stupid. They know, hey, we got a bunch of beneficiaries of Boston. We want to make sure they're covered if they go to these other places throughout the U.S., which most likely you will do. So the insurance companies has an incentive to provide the biggest network they can and maintain profitability. So they're not dumb. It's just the question is, I don't know and you don't know. And so you'd have to do the research to figure that out. And how many people are actually going to do that research? Secondly, is the big deal, is that Medicare Advantage policies change every single year. All right, so if you have an MA, it's short for Medicare Advantage, and if you're like me, you're like, looking at health insurance stuff, I'd much, much rather slit my wrist, jump off the Empire State Building into a pool of starving great white sharks than look through this stuff. It's, oh my goodness, it's painful. Thus, Medigap is for me just because I'm lazy. All right, now, but am I paying more for my laziness? Probably, absolutely. Should you do the same? I have no idea. But just remember, because Medicare Advantage policies change every single year, the in-network docs change, what they offer changes. Some will have a better policy than they had the year before, and you can switch back and forth between MA policies like you're changing underwear. Essentially, it's no big deal. But they do change, and you got to keep up on that for sure. All right, now, we haven't even talked about Part D yet. Part D, which is prescription drugs. All right, so some Medicare Advantage policies will have Part D in it. All right, some will, some won't. You got to keep your eyes and ears peeled on that. Some Medicare Advantages will have Part D in it, and if they do, they're going to change the drugs that they provide to you regularly. I mean, it changes all the time. I'm just telling you. So again, more consternation for me to say, look, I'm on Lexapro this year. There's pretty good coverage, but maybe they drop it off next year. Maybe they change the copays. I mean, I don't know how it works, but you as a consumer need to keep up with how this stuff changes. If you don't, and you thought you were covered, you could easily find yourself not covered anymore because the insurance company, they'll send you the stupid letter, they'll send you the stupid email, but they're not going to read it to you verbatim. You got to do that. And they'll say, hey, Josh, we dropped Lexapro. Oh, man, I didn't know that. Yeah, we sent you an email. Oh, okay, great. So you got to keep up with that. And some of this stuff is pretty, I'm telling you, man, it's pretty insane what the level of coverage they can change on a year-by-year basis on top of the competing entities that are out there as well. So what could be great this year could not be so great next. What was not so great this year might have changed the prescription drug, so that it might not be so great still, but they do give you that drug you need at a discount relative to what just there's so many what ifs you got to look at for sure. Medicare Gap does not have Part D. So if you're doing Medicare Part A, Part B, again, that's original Medicare, and you have a Medicare supplement, you still need to get Part D. And we're going to say Part D costs $35 a month. Again, this is means tested, so it could cost more depending on what your modified adjusted gross income is. All right, but so Part D, it might be part of Part C, it might not be. You got to look. But we know that Part D in of itself is roughly $35 coverage, and that can change every year. I mean, it does. All right, so now let's go. We're going to say we're not doing Medicare Advantage. For Medicare Advantage policies, MA, I would highly refer you to a broker who gets paid on that stuff. A broker, they get paid a commission to sell you the product. but not a captive agent. So you don't want to go to USAA, for instance, or Aetna and say, hey, what kind of policies do you have? Because they're only going to share you their policies. You want to go to a broker like my man Jay and say, hey, Jay, can you shop these policies for me? And what do you see from your experience as the best? Medicare Advantage policies, do not do it on your own. I'm telling you, do it with someone who knows what the heck they're doing. All right, so now we're gonna go back to Medigap, because this is what I think. This is what I'm gonna do. I mean, as long as I can afford it. So now we know we need to get a Part D. All right, so we know this is 135, Part D is 35, and Medigap is 150. We're gonna say. So between 35, 150, and 135, we're paying on average $320 a month, and that's before any co-pays and all that stuff. That's per beneficiary. That's what it's costing us. But we basically have the best coverage that money can buy for the most part. So $320 a month, you times that by 12, that's roughly $4,000 a year with a couple co-pays thrown in. And that's what I use for premiums and insurance coverage, roughly $4,000 a year per person. So husband and wife, $4,000 a year. Now, where it gets confusing, even more so, and this is, again, you thought Social Security was bad, Medigap has a bunch of different plans in it. Plan F, Plan G. I can't remember. They used to have Plan I. I can't remember I think that's the one they discontinued. Plan N. All right, and these are the big three right here. But I think Plan I they discontinued and whatnot. They have discontinued Plan F as of 2020. And what that means is, and this is, I mean, you can still sign up for Plan F right now. You can absolutely could. The drawback, though, is because they discontinue it, that simply means they're going to have no more new blood going into the plan. And that means the plan beneficiary is going to get older and older and older and sicker and sicker and sicker. And you can easily see that the premiums be raised significantly for beneficiaries of the Plan F, simply because they're not getting new, younger, healthier people in there. I don't want to get too deep into that, but just be careful. Everyone defaults to Plan F, and I'm just telling you, I think you should be careful there. Now, what happens with Medigap with these various plans is they'll cover the $185 premium, or what's the deductible for your Part A. They'll cover there's a bunch of things they cover differently than what original Medicare. So on top, so you want to look at these various plans. And again, look at a broker, but this is pretty standard. And this one's a whole lot easier in Medigap because it's standard across. I mean, everyone offers the same thing. Some people offer at a higher price, some people offer a lower price. I guess it's just being naive where you pay a higher price for Plan F with Aetna than you would with, I don't know, United Health or something like that. But that, they're not hesitant to exploit your ignorance, my friend. So if you're not using your study, or at least using a broker, and you're paying $180 for a Plan F, and you live in Georgia and I'm paying $120, it covers the same thing. I mean, it's just you didn't do your research. No other way around that. But generally, these are the three plans. So not only you have Part A, Part B, Part C, Part D, but then within Medigap, again, which is a supplemental policy to Part A, Part D, Part B, you have Plan F, Plan G, Plan N. And Plan F is going away in 2020 for new enrollees. All right. Now, the reason, another thing why I like about Medigap, but this is the issue, is that for you have a guaranteed issue to Medigap right when you sign up for Medicare. They guarantee to bring you on. If you neglect that and go to Medicare Advantage because it's cheaper and you feel, yeah, it's pretty good, but then 3 or 4 years go down the road, you're like, man, my Medicare Advantage stinks, or I do go to Topeka and there's not many doctors in network and this stinks. What happens is you can't just automatically go back to Medigap. You have to be underwritten. So if it turns out you start smoking 2 packs of Cools a day and you got diabetes and stuff, Medigap insurance providers do not have to take you on. They will underwrite you for coverage. So I'm just telling you, be very, very careful before, if you're healthy 65, before you say, I don't want to pay all those premiums on Medigap when I can get Medicare Advantage for basically $10 a month. I'm just telling you right now. You can go from Medicare to Medicare Advantage, MA to MA policies, again, all the time. You can do that without question. You cannot go from Medicare to Medigap without being underwritten. You can go from Medigap to Medicare Advantage plans without being underwritten. Medicare Advantage is very lenient, very flexible, but it changes a lot. It's like this. Blah! It's like electrons. Blah! Medigap, on the other hand, it doesn't do that. You can't go from Medicare Advantage to Medigap without being underwritten. Now, being underwritten doesn't mean you'll be denied. It just means they want to make sure they're not taking on somebody who's at risk to the pool, because if you are at a risk to the pool, they're going to have to raise the premiums on the pool, and they don't want to do that because the pool is already established. So I'm just telling you, be very, very careful before you discount Medigap, i.e. Medicare supplemental policies, and just go to Medicare Advantage, because Medicare Advantage looks cheaper. I'm just telling you right now, be advised. It's a big deal. All right, so that's our tutorial on Medicare. So just remember, we're going to revisit this. We got Part A, hospital insurance. That's part of your OASDI-HI. That's your FICA. You got Part B, which you haven't paid for. That's physician services. That's $135 a month for premium that you will pay at $65. All right, now some people will get, they'll still be on their employer plan, and they'll get HI, hospital insurance, because that's free, but they won't have Part B yet simply because they're on their employer plan. I'm not an expert by any stretch on how that works. Just be advised. You might turn 65 and say, your company says you can enroll, go ahead and enroll for Part A, but you're not going to enroll in Part B because we're still got you covered. And you're like, oh, okay. You're going to have to do some due diligence on that. What I would suggest is find a broker. I mean, I'm just telling you right now. I'd get some guy or some lady who knows this stuff that you implicitly like. I recommend Jay. I mean, no other way around. I said, Jay, help me out with this. Walk me through this. Recognizing that they get paid not from you. They get paid from the insurance companies. The insurance companies sell them commission. Whoop-de-doo. And there's no, I mean, you're not going to get paid $8 million of commission for selling Aetna versus United Healthcare. It doesn't work like that. They get paid commission to put you in the product. And the product will be the one most beneficial to you as long as you use a broker. If you use a captive agent, you just call Aetna, they're going to put you the most beneficial product to them as opposed to you, because they're not going to offer a shop for other plans. They're not. Then you got Part C, which is Medicare Advantage, and Medicare Advantage or Medigap. You got to look at the two. And again, my default is to Medigap because of the reasons I stated here before. And then you got Part D, which is a prescription drug. So Part A, Part B, Part D, and then you can replace Part A and Part B with Part C, or you do Medicare Medicare supplement. Clear as mud. But again, you look at roughly $4,000 a year for premiums on Part A, for Part B, Part D, and Medigap. So just keep that in mind. So if you don't have $4,000 a year of income, we're going to be in a world of hurt. And don't look at Medicaid. I'm just telling you, don't let that be for the poor people who truly need it, not for you. All right. Hey, don't forget to subscribe down below. If this is helpful and you want to support the podcast, share the episode. I'm telling you, Medicare is a big deal. No one gets it. I didn't get it for the longest time. And I'm a CFP with a master's degree. I'm so smart. Just ask me. And if I didn't get it, I imagine the vast majority of people just working their lives off, digging ditches for a living. They're not going to get it because that's not what they do. They don't do this stuff. They rely on the experts, the financial planners, and yet the experts are negligent at best in understanding how this works. We'll see you next time. Thanks.